This this is the case. This is this variceal bleed. So liver disease plus hematemesis is variceal bleed unless proven otherwise, and you have to recognize it early. And what are the OPD or ward clues? Patient will give history of cirrhosis or chronic liver disease plus hematemesis, so you have to assume this is variceal bleed. Or so this or history of portal hypertension. And hematemesis in cirrhotic is emergency, so never delay endoscopy or transfusion while waiting for confirmatory tests. So you have to stabilize and resuscitate immediately. You will give as per Harrison 22nd and AASLD 2022. So AASLD 2022 and Bevino 7th guidelines, and as per Harrison 22nd edition. So you will give broad spectrum antibiotics, ciprofloxacin or ceftriaxone. So why will you give this? So it decreases the risk of spontaneous bacterial peritonitis, and it decreases the risk of sepsis, and it reduces mortality. And you will give vasoactive drugs, for example teripressin, which is preferred, octreotide, and you will start this as soon as possible, even before endoscopy. And transfusion strategy is HB of less than 7, you will give PRBC, platelet of less than 50,000, you will give platelet transfusion, but don't over transfuse. It will increase portal pressure and increase the risk of bleeding. And IV fluid that you will give and maintain urine output greater or equal to 0.5 to 1 ml per kg per hour. So mnemonic is tuna fish. Tuna is T is teripressin or octreotide, U is urgent endoscopy, N is norfloxacin, ceftriaxone, and A is activate transfusion plus fluids. And note that endoscopy is to be done within 12 hours. And if esophageal varices, which are the most common varices, so first line is EVL, that is endoscopic variceal ligation, EVL, and you have to repeat it in 1 to 2 weeks until eradicated. And you have to start prophylaxis, that is secondary prophylaxis, which you give propranolol. If fails, then you have to do repeat endoscopy. If it fails again, then you have to rescue with tips. Now there is this gastric varices, that is fundal or isolated GV1 or GV2. What you do is you give cyanoacrylate glue injection or EUS guided coil embolization, which is the modern and most effective. So this endoscopic ultrasound coil embolization is the most effective. Glue cannot be used in esophagus, it causes necrosis. That is why we don't use glue in esophageal varices. Now balloon tamponade is a temporary measure. It is done only if patient is bleeding massively and endoscopy not available or tips not immediately feasible. Types we have depending upon ports, number of ports. For example, Singston Blackmore, that has got 3 ports as you can see, whereas Minnesota has got 4 ports, and Linton Necklace has got gastric port only, but it is to be used only for less than 24 hours, otherwise there is risk of mucosal necrosis, perforation and fatal complications. And post bleed care, how do you provide this? You have to prevent recurrence. For that you give secondary prophylaxis in the form of non-selective beta blockers, for example propranolol or carvedilol, and you can also do repeat EVL if esophageal varices, and you will treat underlying liver disease. So antibiotics reduce mortality in variceal bleed by greater than 30%, even if there is no infection. So if there is no infection, you still have to give antibiotics to reduce mortality in variceal bleed. So you will either give ceftriaxone or you will give levoflox or piptaz for 5 to 7 days, and it also reduces the risk of spontaneous bacterial peritonitis, reduces the risk of sepsis, and also reduces mortality. And note that as per AASLD 2022 and Bavino 7, EVL is preferred over sclerotherapy. And also as per these guidelines, teripressin is preferred over octreotide in decreasing the mortality, and as per the same guidelines, tips should be considered early within 72 hours in high risk patients. And note that early tips reduces rebleeding and mortality in childhood class C or B with active bleeding. So there is a definite role for this tips in child block C and B with active bleeding as per NEJM 2021. So now what are the pearls? A cirrhotic patient presents with hematemesis. What is the first drug to start? Answer is teripressin or octreotide. These are the vasoactive agents. These are to be started before endoscopy. What are the indications for balloon tamponade? Massive bleeding with failure of or there is delay in endoscopy. Why give antibiotics? To prevent SBP, sepsis, and reduce mortality. So imagine a 40-year-old man, chronic alcoholic, vomiting blood violently in your ER. You stabilize him, insert a Sengstrom Blakemore tube, start antibiotics and teripressin and save his life. So you can say to yourself, I knew it was a variceal. I started early and I saved him. So thanks.